Hello there, my name is Gideon Blecher. I'm a urologist from Melbourne, Australia, and thanks for joining me for this quick rundown of treatment options for erectile dysfunction. Particularly from a primary care perspective, it's important to remember that patients who have erectile dysfunction can result with this for a variety of reasons. It's not just simply their age. There are risk factors for peripheral vascular disease, such as smoking, obesity, hypertension, hypercholesterolemia, and even management of patients' diabetes that we really need to remember, given that the causes of erectile dysfunction are often multifactorial. So once we've addressed these general lifestyle measures, we can then look at other treatments. Now, for psychogenic related erectile dysfunction, obviously psychosexual counseling is going to form a mainstay of treatment. And it's often invaluable to utilize a psychosexual counselor, even if the primary reason for the erectile dysfunction is not psychogenic. For example, the diabetic patient may also suffer psychologically and need some sort of support. Even though their primary reason is the diabetes, the psychology is relevant too. PDE5 inhibitors are really the first line medical management, and there are a variety of available on the market depending on where you live. And they're all fairly similar, and they work by essentially decreasing intracellular calcium, which thereby opens up small arterial vessels in the penile region, and that induces an erection. Now, it also opens up blood vessels in other areas of the bodies, and hence why people will get a red face or sometimes headache or a bit of congestion within the nasal sinuses. But generally, they're well tolerated and used quite successfully all across the globe. The biggest problem really is probably their tolerability, and there's always a small risk of a priapism, which is an erection that lasts more than 4 hours. And that's a particular problem if you're a younger patient with good erections to start with, or if there's a mixture of other medications involved. The next second line options include either a vacuum erectile device with or without a penile ring or intracavernosal injections. The vacuum device is a great tool for many men, although most people overall don't prefer it as an option. The reason is because it can be uncomfortable, particularly with the penile ring. You can only really use it for a definite period of time, be it 5 to 20 to 30 minutes before it becomes too uncomfortable. And it adds, say, a 10 to 20% increase in the strength of the erection. So it can be used together with some of the other treatment options. So that's its benefit. You only have to buy it once, really, and it'll last you 1, 2, 3 years. And the side effects are really minimal, apart from if it's used too aggressively, it can cause discomfort or even some bruising superficially within the skin. Intracavernosal injections are essentially a higher dose of medication delivered into the penis itself. Each time the person would like to have an erection, they need to inject the medication. And the biggest drawback is, number one, many patients don't like injecting. And number two, it requires that every time you want an erection, there needs to be an injection. There are various formulations available, but commonly alprostadil is probably one of the more common ones. But there's a mixture of other available ones that can sometimes be available, again, depending on where you live. And finally, the ultimate treatment really, if all else fails, is a penile implant surgery. And whilst this is the most invasive, it really affords a reliable erection. So the anxiety related to uncertainty is how the erections are going to result, what kind of interaction are we going to have. Really, all of that's pushed aside once the patients have an inflatable penile implant or a malleable implant. The main downsides are really that it requires a surgery with its recovery and inherent risks, and particularly including that of infection. But overall, the satisfaction results are quite high, 85, 90% satisfaction rates. Thank you for joining me. And if you'd like any further information, please head to the ISSM website.